let's also get a roundup of what the situation is as far as Maharashtra and specifically Mumbai is concerned. My colleague Sujata Dwivedi with us on the broadcast now. Sujata, can you quickly talk us through the number of cases that Maharashtra is logging? Because we've been given to understand that Maharashtra is one of the states where the highest number of COVID-19 cases have been reported. Firstly, how many cases overall in the state? And secondly, which are the districts that are worst affected?
Well, yes, if we talk about the cases that has been registered in Maharashtra so far, so in the last few days, we see that there has been a rise of 45% in the number of patients which are being tested, and also they turn out to be COVID positive. Apart from that, we also see that talking about the most affected areas in Maharashtra, especially Mumbai, which is the financial capital, seems to be the most affected with the COVID-19, where we see that because of the daily routine, where we see that in the suburbs, especially in the town areas have been considered as high risk areas and they have been put on red alert. Talking about areas like Dadar, Prabhadevi, Lower Parel, all of these have been put on high alert because of the number of cases that are being registered. And also we see that the government has now made masks mandatory in all the government hospitals. From now on, every patient who visits the government hospital will have to wear a mask because of the rising cases. As Manohar mentioned, that there were mock drills that were being conducted today as well as yesterday, taking a gauge at the preparedness of the hospitals for be it the number of beds or the availability of the medicines, staff, as how the patients are being treated. So as of now, we see that the hospitals have been given guidelines to follow the protocols which are being set by the government, and also to keep a close eye and increase the number of testing of the patients, because we see that in the last 2 days, 45% cases have been on a rise, and yesterday itself in Maharashtra, there were more than 900 cases that were registered, out of which around 350 were from Mumbai itself.
Yes.
So Maharashtra is the biggest contributor for the COVID-19 cases across the nation. And why Mumbai has been set on high alert, and meetings are being held by the state health department with the center officials to gauge the preparedness, and also to also fill the gap if there's any in the government hospitals. Because if I talk about the Seven Hill Hospital in Nanderi, or St. George Hospital, or JJ Hospital, all of them had a specific special dedicated COVID ward, and Seven Hill Hospital is a special hospital which has been completely dedicated to treat the COVID patients. Now Seven Hill Hospital has around 1850 beds, out of which currently only 300 beds are being occupied. So as of now, patients are preferring, those who are turning out to be COVID positive, they are preferring to be at home and recover because they show that asymptomatic symptoms. Apart from that, the patients who prefer to get admitted in the hospital and treat themselves, for them the beds are being kept ready along with oxygen facilities as well as ventilators, so that immediate treatment can be given to them and also curb the spread of the virus. Yeah.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.